Green social prescribing is of its time. It's universally available on people's doorsteps. They give people the opportunity to address their health needs right close to where they live by participating in a raft of activities that give them social purpose, social opportunities, and deliver health benefits for them.
I feel green social prescribing has a significant role for healthcare in the UK.
It's about identifying people with an unmet health need, connecting those to community-based activities through a co-production process. So it's not just about signposting, it's a co-production process that means that those activities meet the unmet health needs of the individual.
I'm really excited about the future of green social prescribing in the UK. I think it's catching this wave as it really takes off and goes forward. So where I would like it to be in the future is actually it's not necessarily like a demarcated thing. It's just part and parcel of everyday healthcare.
We released some evidence in July that said for every 1.2 million people you reach through green prescribing activities, you will get 100 million in NHS cost savings. And we asked some economists to do that piece of work for us. And at the back of that very short report, we echo the calls from across the sector that say that music and arts and nature and justice and all these things can make a big difference.
I wonder sometimes whether people get caught up with some of the NHS conversations about thinking that we're treating an illness. Whereas for me, I would hope that green social prescribing is about creating healthy communities and creating good health.
There are a lot of obstacles in the way at the moment. I think there's too much bureaucracy and there's too much reliance on strict science and evidence-based medicine that does not lean itself to the holistic nature of connection to nature and the benefits that it can offer.
We need to move into the community. That is where the social determinants are driving the health outcome. So we need to move into the community, and we're starting to hear discussions around not a national health service, but a neighbourhood health service. That is part of this shift into the community.
They want to focus on the system. And there were so many people in the room saying the system is not where social prescribing is going to make the biggest difference. It's at community level. If we walk away thinking, well, the ICB are not really going to change anything. My job, and I see this as my life's job now, is to try and change the percentage of money that's spent on acute services and therapies and convert that into health creation and preventative agendas. And if you took even a 0.4% of the ICB's budget away from acute services and put it into preventative areas like social prescribing and health creation activities in our local communities, the impact over time will be huge.
The main barrier from my perspective is very simple. It's just money, it's resources. So that access to commission funding is really key. You know, we need a sustainable pipeline of efficient funding for us to really grow our work, and I'm sure it's the same for everybody in the room.
When the NHS can put their hands in pockets and pay for it. And for me, I don't see that happening. And I think the fact that we keep stuck on that question is stopping us moving on.
There's an awful lot of burnout with the providers locally. They're living 6 months to 6 months with the funding not being coordinated. No one's actually a funding expert. Why would they be? Their passion is doing the work, and they're not really able to do that. So what can we do to try and make that more feasible?
You really need this to be consistency. So one of the things that we've worked really, really hard to do is to try and manage our funding in a way that we're not dipping in and then coming back out of communities, because you really need trusted referral pathways. You can't just dip into a community for 6 weeks and think that you're going to kind of transform either nature or that community, or you're going to have a limited impact.
If there was a national single platform where providers and prescribers could get together and be able to communicate, and for us to be able to set out our stall in terms of what we can do, but for prescribers to be able to select from a menu of what's available.
keep being complementary with the provision. So we heard this morning that the strength is in non-medical approaches. I think that's critical because the solution is that kind of community-based healthcare.
I'd like to see everybody represented in the natural environment. At the moment, it's white, middle class, and that's not sustainable. Every part of society has to be feeling comfortable if they want to be out in the natural environment. I'd like people to feel a much greater sense of ownership over their local green spaces, whatever those green spaces are. Rather than it being done to them, I want them feeling they've got agency in the design of the process.
A couple of years ago, you wouldn't see black people in the mountains, and now we do, but we're not seeing anyone apart from myself in this room today. So we can have conversations, but actually making the changes are leading by example, so we have to be conscious of that.
We need sustainable investment to build that social infrastructure and that connectivity, and to rebuild those depleted communities with respect to their provision and their ability to be, and I think someone used the word this morning, to be thriving communities, not just surviving communities. Really, really good statistics in terms of access and reach into deprived communities and ethnic communities. Much, much better than the NHS ever manages. So reach is amplified through green social prescribing. The participants that were involved, there was a statistical improvement in their well-being, their mental well-being, for everybody that was on the program. And then finally, really good returns on investment.
From my perspective, the future of it is prevention rather than cure. And that's why I think not targeting, that's a very strong word, but aiming to develop young minds and being conscious with our efforts and getting outdoor education into the curriculum and just overall generating a positive stance on nature with young people, I think is the best way forward, because when they grow up they will learn to respect the world we live in and probably have a better understanding of their self and the resilience and everything what goes towards that, which then prevents mental health issues in society today. So,
well, I think the future for green social prescribing is really bright. There's a huge community that's gathering around it and an investment into the sector that's fantastic. So lots of growth, lots of diversity, lots of different sorts of provision, which is fantastic. But for me, I think the most exciting thing is to move away from green social prescribing being about intervention, about fixing people when they're broken, and it's much more about creating resilience. So it's about getting people knowing that nature is going to be a great healing power for them, encouraging them to spend time outside because that's where we are most human, that's where we thrive. So that really for me is the real focus and the vision is to be working with people, young and old from every part of society, to encourage them to be out in nature, to be less of an indoor society and much more of an outdoor.
3, 2, 1. Fantastic.